Hello, everyone. You're very welcome to take a seat, grab your bag, your lunch, and be here with us with the session that's going to start in 1 minute. I know it's lunchtime, so a little difficult right now, but there's lunch in the bags that you can grab your bags and be here with us today. It's going to be very interesting to have this panelist in this forum today. So thanks for being here with us.
Thank you.
Yes? So we welcome everyone who is outside to come here and join us, and the ones that are here having lunch with us. Thank you so much for attending this session. It's a pleasure to be here with you all. My name is Andrea Bernal. I'm a Colombian Ecuadorian journalist for NTN24, an international channel TV station in Latin America. And thanks for inviting me to this important session, Clean Air for All, Addressing Pollution in South Asia for a Healthier Future. I've learned so much in 2 days, so I'm very grateful for this. Thank you so much. It's an honor to facilitate this crucial conversation at the second Global Conference on Air Pollution and Health, hosted by WHO, as we focus on regional solutions for cleaner air in the Indo-Gangetic Plain and the Himalayan foothills. I've been trying to have a grab as a journalist of what is important on air pollution, why is it important, the quality of air, and when we see Latin America, maybe we are not seeing it still as we should. So this is going to be very enlightenment for you guys, for the people that are here, to learn also for our continent, how can we do better things or help as an example as well. So as you know, air pollution is the leading environmental risk to health. And the latest World Bank report is estimated that outdoor air pollution kills roughly 5.7 million people globally per year, with 95% of deaths occurring in low and middle income countries. And we are talking here about South Asia. It is home to over 9 out of 10 most polluted cities. Air pollution in South Asia is cutting down average life expectancy by 5 years. And just with that data, I want to go over the panel that we're going to have today. First, I want to introduce, and I'm very pleased to have with us a distinguished panel of experts and policymakers who are leading efforts to improve air quality in the region. I want to introduce and to thank her so much because I think it's almost midnight, if I'm right, in Bangladesh. Is with us Ms. Saida Rizwana Hassan, Advisor, Ministry of Environment, Forest and Climate Change from Bangladesh. Mrs. Saida, are you hearing me right now?
Yes, I can hear you.
Well, it's a pleasure to have you, and also to thank you for being with us, since we know it's very, very late, almost, what is today? Today is Wednesday, almost a Thursday now. So thank you so much for being here with us today. I want to introduce also Dr. Arunabha Ghosh, CEO, Council on Energy, Environment and Water. Also with us today, Mr. Raja Jangir Anwar, Secretary, Environment Protection and Climate Change Department from Punjab Province, Pakistan. And Dr. Pema Gyamso, Director General, the International Center for Integrated Mountain Development, Nepal. Sirs, thank you for being here with us in Colombia, in Cartagena. Really, it's a pleasure to have you and welcome. Each of our panelists are going to bring a unique perspective from national policy leadership to regional environmental cooperation. We're going to be not interviewing in this time, but having a chat, a conversation that could open this theme to all of us. And before we start the panel, and I introduce also a very important person today, Christian Peter. I want to introduce a video about stories of 4 countries in South Asia showcasing challenges as well as solutions in our theme today, in air pollution.
जो मिट्टी वाला चूल्हा पर खाना बनाते थे तो ज़्यादा धुआं होता था और उससे ज़्यादा खांसते थे और दम भी घुटते थे। नया चूल्हा में फैन लगल है, फूकने नहीं पड़ता है, तो वहाँ पर खाना भी बनाते हैं, बाल बच्चा वहाँ पर बगल में पढ़ते लिखते रहते हैं। अब जब से नया चूल्हा मिला है तब से नहीं खांसते हैं और चश्मा लगाना भी छोड़ दिए।
नेपालमा आजको दिनमा हामीसँग धेरै इन्डस्ट्रीहरू छन् जुन पोल्युसनको मेन सोर्सहरू जुन त्यसमा चाहिँ नि हामीले ट्रान्सपोर्ट सेक्टरलाई मान्ने हो भने जस्तो नेपालमा सीवेज पनि छैन, अब रेलवेज पनि छैन हैन, सबै रोडवेज मात्र छ। रोडवेजमा जति पनि गाडीहरू चल्छ त्यो सबै डिजल गाडीहरू चल्छ।
For a city like Kathmandu, I would really think that cycling and EV is the solution. There's no doubt about it. Progression to actually go into bicycling or walking or taking care a little bit more about where we live, and I think that is just what is required in the next generation.
ਸਭ ਤੋਂ ਵੱਡਾ ਜੀ ਪੋਲੂਸ਼ਨ ਤੇ ਆਲੂਦਗੀ ਜਿਹੜੀ ਹੈ ਜੀ ਉਹ ਇਹੀ ਹੈ ਜੀ ਕਿ ਇਹਨਾਂ ਦਿਨਾਂ ਦੇ ਵਿੱਚ ਜਿਹੜੀਆਂ ਫਸਲਾਂ ਦੀਆਂ ਬਾਕੀਆਤ ਨੇ ਜਿਸ ਟਾਈਮ ਉਹਨਾਂ ਨੂੰ ਅੱਗਾਂ ਲੱਗਦੀਆਂ ਨੇ ਉਹਨਾਂ ਦੀ ਵਜ੍ਹਾ ਤੋਂ ਜਿਹੜਾ ਨਾ ਜੀ ਪੋਲੂਸ਼ਨ ਹੁੰਦੀ ਹੈ, ਸਮੋਗ ਤੇ ਬਣਦੀ ਹੈ। ਸਾਡੇ ਕੋਲ ਕੋਈ ਹਾਲਾਤ ਕੋਈ ਨਹੀਂ ਕਿ ਜਿਨ੍ਹਾਂ ਦੇ ਨਾਲ ਅਸੀਂ ਇਸ ਨੂੰ ਕੰਟਰੋਲ ਕਰੀਏ ਜੀ।
তখন আসলে আমি বুঝতাম না যে আমি এত অসুস্থ কেন হই, আমার এত শরীর খারাপ কেন হয়। তারপর আস্তে আস্তে আমি বুঝতে পারলাম যে এগুলো কিছু করার নেই, কোনো উপায় নেই। আমি যখন স্কুলে যাই, থিয়েটারে যাই, তখন আমার মেন রোড ক্রস করেই যেতে হয়। আমার বাবা মেন রোডের পাশেই কাজ করে, তো আমাদের প্রতিনিয়ত ধুলাবালি, গাড়ির ধোঁয়া, রাস্তাঘাটের ধুলাবালি এইসব আমাদের ফেস করতেই হয়। একটা সংস্থার সাথে কাজ করেছিলাম ক্লাইমেট চেঞ্জ নিয়ে। আমি চাই আমার বাবা যেখানে কাজ করে সেখানে যেন ধুলাবালি মুক্ত পরিবেশে কাজ করতে পারে, বাংলাদেশের প্রত্যেকটি মানুষই যেন সুন্দরভাবে বাঁচতে পারে। আমি চাই বাংলাদেশ হবে স্বপ্নের দেশ।
Solvable and needs urgent actions. I'll stay with that phrase at the end. Thank you so much. We're going to begin this panel opening remarks from Christian Peter. He's a practice manager from South Asia region, Environment, World Bank, and followed next by our panel discussion, and we'll have some closing remarks as well. Christian, welcome.
Thank you very much, and thank you, distinguished panel, and I'm really thankful that the Honorable Advisor Rizwana Hassan found the time to join us, even if it's only virtually. because this is really something which you saw in the video, which is something that affects everybody, that affects all the different sectors, it affects all the different countries, and we're looking at this as an institution. We're looking this really as what we call an airshed, or what everybody calls an airshed approach, which means that we look across different jurisdictions, because what we recognize, and this is what we have found in our research and our analytics, is that only so much can be done by a jurisdiction alone, by the government in the jurisdiction alone. You need to work, you need to collaborate with others, you need to really work together. And for us as an institution, and I'm just sort of looking back on where we are coming from as an institution, we have recently changed our mission statement with our new president coming in, Mr. Ajay Banga. And it is really to end extreme poverty and boost shared prosperity on a livable planet. So this on a livable planet was the add-on which we have now in our mission statement. And it is really, air pollution is really one of the things that need to be addressed in order to really make this planet livable. Otherwise, what's the point? So I really appreciate the panel, our panelists, and I'm really looking forward to hear, because they have been the champions working with us in their respective jurisdictions, in their respective government, in their respective cities and countries, to really come together, bring about the demand and respond to demands from the population in order to address this. There are so many different solutions. It cannot be done in one sector. It cannot be done in one place. It needs to, it requires us to work together and do this multisectoral, and do this also across different boundaries, because air, as Dr. Pemba said in the other section, in the other session we just came from, air doesn't respect boundaries. So with this, thank you very much, Andrea, for leading us through this, and I'm really looking forward to the conversation, as you said, and also have a possibility to really come together and discuss this.
Christian, thank you so much for these opening remarks. So I'm looking also forward to this conversation. I want to start with Ms. Saida. Again, thank you for connecting with us via video link to from Dhaka, Bangladesh. Bangladesh has made, no doubt, significant strides in air quality management. What are some of these most successful policies or initiatives that could be replicated in some of your neighboring countries? We would like to start with that.
Okay. Thank you very much. The air of Bangladesh, particularly of its capital Dhaka, is not very healthy. And for the last 10-12 years, we are hearing that some days we are actually getting the top ranking for having the world's worst air. But then while we have the capital in the country, we do have other cities in the country that have made significant improvement in really checking on the air quality. We have got a city called Rajshahi, where the air quality is not bad at all. So this is a country where you have the city with the world's worst air quality. You have a city that has made significant improvement in checking air pollution. So the citizens of Bangladesh are worried. They're worried because the air pollution here is very complex, it's widespread, and it's actually very dynamic. It's not coming from one given source. 30 to 35% of our air pollution comes from the neighboring countries. So what Bangladesh has done, due to support that we have got from World Bank and other development partners, and also from pressures that were coming from the judiciary, the media, and the community, we have finalized the air quality management rule. And under that management rule, we have also formulated a very elaborate air quality management plan. But this we have managed to do in last year only. The air quality management rule that we have, which is a binding legal document, that has actually followed the WHO interim targets, and it has set standards for different sectors that are responsible for causing air pollution. We have set the emission level. We have also talked about how to do the abatement in certain actors. We have addressed the indoor air pollution and the outdoor air pollution. In the indoor air pollution, we have given the local government agencies the specific responsibilities to improve the quality of stove. And we have also kept provision for declaring certain areas as degraded airsheds. So although this plan has been finalized in August 2024, which is last year, its implementation has kicked off. We had the political turmoil here in Bangladesh. So now that it's under control, we have started to implement this air quality management plan and the air quality management rules. So the time frame that we have set for the management plan is 2024 to 2023, and we are targeting, it's time bound. We have identified some priority areas. The target is to ensure that the average Bangladeshi's exposure to the major pollutants is significantly reduced, and the number of good and moderate air quality days for the air quality index increases. We are also thinking about, so in terms of policy and plan, I think we are on very much on the right track, and we have sorted out a coordination mechanism, which means that it is not only the responsibility of the Ministry of Environment and Forest, but other responsible agencies, public agencies and private actors also come forward, and their responsibilities have been very elaborately and in a pinpoint manner described. We are now, with support from World Bank, finalizing a project which is called the Bangladesh Clean Air Project. The government is expected to give approval to this project very soon, where we are targeting to have better regulations and enforcement and implementation of regulations. We are also talking about having more continued emission monitoring system in targeted industries and expansion of an environment endowment fund. And when we talk about having more policies, what does it really mean? So we would try to ensure that the public transportation system is modernized when we talk about a policy framework. So there will be a favorable policy for modernizing the bus system and for also introducing the e-buses. We have also talked about having more vehicle inspection center. In terms of regulation, what do we mean by having better regulation? We already have the rule and the action plan. This regulation is more about enforcement and targeting certain sector. For example, this year itself, we probably will be declaring certain parts of Dhaka, which some days have the world's worst air, as burnt brick filled free zone. So there will be no burnt brick around Dhaka city. We have also declared that after May 2025, we are going to phase out the old buses, and there will be joint monitoring by the Ministry of Environment and the Bangladesh Road Transport Authority. But once you take off the burnt bricks, you have to provide alternatives, and in policy, we will try to set a target so that the alternatives to burnt brick, which is a major source of pollution here in Bangladesh, can be promoted, say, by 20%. So this is where we stand in terms of our plans, rules, and policies. And we are also very seriously targeting the road dust. So my ministry is working with the local government agencies, and we have already taken measurement of all the major roads in Dhaka where we still have uncovered areas. So the plan is to green all the brown areas of Dhaka roads, so that the dust emission is controlled. We are also thinking about employing more volunteers for cleaning the road, because dust pollution is a major source of air pollution. We have 30 to 35% air pollution coming from the neighboring country. That remains a major challenge, but in terms of dust pollution, targeting certain industry, I think we will do better this year. In fact, last year, after we demolished some of the illegal and unauthorized burnt brick factories, the air quality has significantly improved. But to sustain that, we have to really go for more enforcement, look for better alternatives, and modernize some of our systems.
Yeah, thanks for
With
that.
this,
Thank
for
you.
now?
Yeah, thanks for that, Ms. Aida. Coordination mechanisms, right track, improvements, some of the important words that Ms. Saida just talked to us. I would like to continue this conversation talking about improvements. Dr. Gosh, I would like to start this forum here with you by talking about the 35 by 35. Since Ms. Saida is talking about improvements, coordination mechanisms, we are on the right tracks. This is an aspirational target. I've heard a lot of that. Yeah, aspirational target. Now, later we're going to say how to turn it into aspirational to a real goal. But let's start with the aspirational target. 35 by 35 is the target being set for the countries and jurisdiction in South Asia. And that will mean that most of the people living in the IGP area will be able to breathe relatively clean air. That means 35 micrograms per cubic meter by 2035. 35 by 35. What do you think about setting this target?
Thank you very much to the World Bank for inviting me. Thank you, Andrea, for setting out the context. And of course, it was very nice to hear from Ms. Saida Hassan about what Bangladesh is planning. I think it's not only important to have an aspiration, it's very important to have an actionable aspiration. Because, you know, a vision without a plan is only a dream, as they say. Right? So the question is this just aspirational or is this actionable and achievable? And I think it is certainly actionable and achievable. If you take the National Capital Region in Delhi right now, we have an average level of about 102 micrograms. So 35 by 35 would mean basically about a 65% reduction. What I was saying in the earlier session, that a plan I've put forward helps to reduce it by about 20% within 3 years, about 40% within 5 years. So I think this is very much in line with that kind of a trajectory. But in order to make it actionable and achievable, you have to understand what is sort of, in a way, unique about the broader geography we are talking about. One thing is that we will have multiple point sources of pollution. We are all at different stages of development, but all are developing and emerging economies. So construction activities will be continuing. Vehicles or urbanization will happen, so therefore mobility as a system will grow. Now, what type of mobility will be a choice? Industry will be a source of jobs growth, and therefore in what type of industrialization? Our economies are also where majority of the population lives in rural areas, at least for now. So agriculture will also be an economic driver. So again, what type of sustainable agriculture? When we start breaking it down this way, the action on air pollution has to be a part of what I call a broader economic development strategy. So rather than think of air pollution as a liability, we have to think of clean air as an economic asset. This is very important because often the conversation on air pollution is interpreted or misinterpreted as environment versus development. And it works because, you know, developed countries have developed and then cleaned up, what is called the environmental Kuznets curve. And my proposition is for economies like ours, we may no longer have time for the environmental Kuznets curve to play out, that it develop first and clean up later. So what is the model of development where clean air becomes an economic asset? In what way? Your worker productivity increases. Your educational outcome improves, means the quality of your workforce improves. you're not shutting down construction activities if you follow green construction practices. So you continue to build. Your mobility transition enables a whole new way of not just providing public transport, but clean public transport, which actually reduces time traveled, and therefore time is money, and therefore the labor that's moving from, say, the extremities of the city to the center are spending less time on the roads and more time making a living. Agricultural yields increase. And guess what? Foreign direct investment also increases. In China, I think one study says for every 1% increase in AQI, FDI reduces by 0.4%. So the point here is, once we pitch it as this is an investment rather than a cost in our economic development, which also then happens to become sustainable economic development, then you have a coherence, not just in a sector by sector approach, in a bottom-up approach, but it aligns with the top-down framing of a 35 by 35 aspiration, but also a framing of development. India has an aspiration to be a developed economy by 2047. Bangladesh is moving from a least developed country status to a low income country status, and has an aspiration of reaching a certain income level again by a certain date. So like that, each of our economies has these economic aspirations, and I would just simply put it that the aspiration will be actionable and achievable if we link it to a economic development come sustainable development narrative.
Very, very interesting. Clean air as an economic asset. And what we know is that we cannot do it alone. And that's why I want to bring to this conversation to Secretary Raja. Secretary, thanks for being here with us. In Punjab province in Pakistan, there's an understanding of what Dr. Ghosh is saying as an economic asset, as an investment. What policies or actions is the government implementing to mitigate air quality challenges? And also, very important, what support is needed from regional partners? Because this cannot be done alone.
Bismillah ar-Rahman Rahim. At the very outset, I must thankful to the World Bank on behalf of the government of Punjab. For the last so many years, the World Bank has funded us, provided expertise, technical assistance, commitment, and that has been phenomenal in terms of finding the direction and putting the environment on the top priority agenda of the present government. And we look forward to continue this partnership with the World Bank. As you just mentioned, what kind of actions are just a few minutes back on the sideline of a meeting, we were exchanging notes with Dr. Ghosh. There are a lot to learn from each other. We all are, as Christian just mentioned, that's called watershed. Pollution doesn't respect boundaries. So we all are suffering. Like 25% of the global population live in South Asia. And this is the high time and the right time to stand up together and make a joint effort for a cleaner air and healthier air. Second part is, of course, Lahore is losing business. Lahore is the worst sufferer in terms of air quality. Lahore is losing tourism, Lahore is losing business, Lahore is losing trade. So it has an economic cost now. It is no more a choice, it is no more a fancy. It is now, this is the time that all governments, regardless of the boundaries, they have to make investment for their own future. In Punjab province, we are actually, there are 7 big challenges, and we are working around those 7 challenges. Of course, the stubble burning, the crop residue burning is one big challenge. The government of Punjab has provided 5,000 super seeders on subsidized rates. Government has picked up 60% of the total cost, and 5,000 more are in the pipeline. Similarly, vehicular emission is one of the greatest challenge of the present time. Punjab has 25 million vehicles registered with its departments, and 20 million are 2 and 3 wheelers, and 5 million are 4 wheelers. Vehicle inspection and certification system, Christian in another session has mentioned that we have actually started privatizing it because there were only 32 VIC stations, vehicle inspection system, across Punjab for 25 million vehicles. Now there are over 1,000 VIC station in the private sector and more to come. Similarly, 500 electric buses are going to be inducted in Lahore alone because we need 1,500 buses to completely replace the gasoline buses. Similarly, government has imposed a ban on purchasing gasoline motorbikes in their own public sector. Now everyone has to buy electric bike. I'm talking about the public sector. Government has provided 50,000 electric bikes to its students on the subsidized rates. So people are now switching over to the electric vehicle regime. And this has started during the last 1 year. Now we're working as a whole of government approach. All the relevant departments, including agriculture, transport, energy, local government, environment, all have been housed in one place. And senior minister herself take 15 days review. Certain, there's a block allocation of 10 billion rupees at the disposal of Environment Department for fighting the air pollution. Then comes the brick-in emission. My Director General is sitting in the audience. There are 11,000 brick-ins in Punjab, and 1,500 has been demolished by this gentleman because those violators were chronic, and there was no other way left with us to demolish them. Then we have industrial emission. I'm confidently saying this, that 100% of the industry inside Lahore has been shifted to emission control systems, and that has been verified by the third party. Then we have fugitive dust. Fugitive dust, as everyone knows, that Lahore is probably the fastest growing city in Pakistan. There are 1,500 construction sites at the moment, and as we know, fugitive dust constitute a major part in the smokes, and this time we have made it compulsory and mandatory to install, set up a sprinkling mist system on each and every construction site. Then there is a huge gap between us and the public. And this time, the very aggressive media campaign to make people realize this is your city, you have to take responsibility, and making people realize that together we have to fight it. So previously, people used to think it is just government's job to fight for the environment and to correct things. Climate diplomacy is one new thing. This mantra has been new to this probably landscape. Our chief minister, she raised this issue, and she intends to even visit the neighboring countries. And we also intend to hold a regional conference in Lahore very soon. So we actually are together in this, regardless of the boundaries and the state. But this is, and there's another big area which I simply missed, and that is that World Bank has to have, a regular feature on regional cooperation amongst the countries. I think World Bank can play a very, very important role, making everyone sit together on one agenda, which can be acceptable to all, and then we can work together towards the same direction for clean air. Thank you very much.
And some points that we can talk about in our second round. Dr. Pema, given ICMOD's regional perspective and mandate, I will want to go back to the 35 by 35, because it wasn't the way that Dr. Ghosh was saying. It's aspirational goal, but I wanted to ask you, do you see it as a possible goal? We've just heard Secretary and then also Ms. Saida talk about the improvements or the things that they're doing inside, the efforts that are inside their countries. Do you see it as a possible goal if all the countries work together, and what could be done to put them to work together to achieve this goal?
Thank you very much. I would say it's not only achievable, not only actionable, I feel that we can actually exceed that aspirational goals, and we have to do that. I think this, you have heard the arguments, in terms of health benefits, in terms of economic benefits, ecological benefits, and so on. So I think there is no argument against action now. And South Asia, as we have heard, is one of the most polluted regions in the world, if not the most polluted. Therefore, we need to get together on a war footing and take this on. I think we have to take this war against pollution really on a war footing. We must win the battles in every sector. And I think there's no time to lose now. Now, from the work that Isimoth is doing, we also feel very deeply worried that air pollution is not just affecting health, not just affecting economy, it's not just affecting our environment. But if you look what is happening up on the top of the mountains, because of the emissions, black carbon emissions in particular, it is accelerating the melting of the glaciers, the ice pack, the snow cover. So it is affecting the water security as well. It is affecting the energy security. It is affecting food security. So I think the region as a whole really needs to get together. And I'm very encouraged to hear the champions here, the leaders from our member countries talking the same language. And this is what we have seen in the science policy dialogues that we have been conducting together with the World Bank. And World Bank is really, taking this forward. And Isimoth provides the platform to bring the scientists and the policymakers together to discuss about these issues. But we believe that science must inform policy. Science must inform practice. So we need to see what we can learn from each other and what we can share with each other. And I think when it comes to air pollution, when it comes to climate change, we all agree that these are transboundary issues, be it disasters that are caused by climate change, be it the health impacts caused by air pollution. I think we are all in it together. And now we have seen that from the reports, the number of cities, the most polluted cities are in our region. Yes, but beyond the cities, I think what is happening, even in rural areas, we have huge numbers of households that are still using, biofuels. That's still using firewood, using, cattle dung cakes and so on, which are, very, very harmful to the health. So what can we do? The solutions are there. So we really need to go in with investment. So therefore, now the science policy dialogue is extended to include the finance, including the private sector. Now, when we have these science policy dialogues, what gives me the optimism to say that we can exceed the targets or aspirational target is the kind of energy and enthusiasms that the scientists and the policymakers bring to the table. Now, you have seen it today. And when we have our meetings, we have Pakistanis, we have Indians, we have Bangladeshis, Bhutanese, Nepalese. I'm also happy to see there's somebody from Nepal or some, members from Nepal. So all of us are here. And, we can see the energy. We can see the enthusiasm. And our policymakers will definitely listen to scientists, because science have to, provide the evidence and so on. Now, some may think that why Bhutan? Bhutan is relatively, at the moment, not so polluted, I would say. But we cannot remain complacent because we have heard it over and over again. Air knows no boundary. So polluted air actually crosses boundaries. And Bhutan is not spared. As we are talking, huge areas of forests are being burned, wildfires. And wildfires, short-term pollutant, that at the moment we have no solutions. And we need to work together also on that, on crop residue. And you heard about brick cleans, and Isimoth is very proud that we have been able to facilitate the sharing of good practices, technologies from one country to another, from Nepal to Pakistan and vice versa and so on. So we are really privileged to serve the region in bringing together the policymakers, the scientists, and discuss these common challenges, and we'll continue to do that. Thank you.
Important things are happening here, as you say, Dr. Pema. Ms. Saida, are you that optimistic, like Mr. Dr. Pema? He says that we're going to exceed the 35 by 35, not just, no, it's just not a possible goal, but exceed that goal. Are you that optimistic? And as well, I wanted to ask you, what mechanisms do you see as most effective in fostering stronger cross-border collaboration for tackling air quality in South Asia, since we've been hearing from all of our panelists that we need collaboration, working together? So those two questions for you.
Thank you. I am optimistic because that is what I have been fighting for the whole of my life. And there is reason for us to really ensure that the air that we breathe, the air that our children breathe, the air that our mothers and fathers are breathing are not causing them deadly diseases. Because in Bangladesh, it's said that 200,000 people die every year because of air pollution, and the average lifespan is reduced between 5 and 7 years in certain polluted cities like Dhaka. And it can be anyone from my family also. So I'm under compulsion to really be optimistic, and it's not something that cannot be done. The technologies are there, the alternatives are there, and you know that the cost of inaction is much higher than the cost of action. So it has to be taken as a package, as part of your development programs. And we have to increase the capacities of the institution. I also have to be optimistic because I really don't want to go to sleep now. It's midnight here with the bad feeling that
yeah, thanks for that.
to rectify the problem. We have to have the commitment. Now, how far can we go? In a complex regional political setup in South Asia is something we have to really ponder, but these are humanitarian issues. These are not complex political issues. So the polluted air coming to Bangladesh from our neighboring country means that their air is also polluted. So if they have to save their citizens, they have to improve on their air quality. And if they improve on their air quality for the sake of their own citizens, that helps my purpose. I know that in, there are initiatives, there are dialogues. We have this Kathmandu roadmap, and probably there was something in Thimphu which 5 countries have endorsed. So there is some degree of political commitment, but I think we need more political commitment and real commitment that can be translated into action. So it has to do a lot with our energy policy. It has to deal with our transportation policy. So yes, I think regional approach is very important, because if 35% is coming from India, and Bangladesh will have to take care of the 65%. If 35% is coming from India, means that Indian air is also not very good. So there is absolute reason for me to be hopeful, because those who are involved in the policy making, those who are involved in politics, they'll definitely have to serve the purpose of the people and not otherwise.
And thanks for that optimism, Ms. Saida. Thank you. Dr. Ghosh, as Ms. Saida says, there's a real commitment. Technology is there, science is there. We just heard funding is there, awareness is there, which is important. What are we lacking? That was a tough one.
Yeah, it's a tough one. So let me say at the outset, there is, despite the conference, and we've got Maria Nera here in the room. Thank you for your leadership. Despite all of us here, I think outside of this convention center, back when we go home, there is also what is lacking, or what is abundant rather, is that there is also a sense of despair. And the sense of despair comes from this feeling that it's too complex, or it's someone else's problem, or as an ordinary citizen, I often argue with my colleagues. I say, we are both the economic agent by day and the citizen by night. The citizen by night wants clean air. The economic agent by day decides to drive a diesel vehicle to work, right? So this individual level schizophrenia then compounds in this collective despair. And I think it's very important to recognize that despite our inside the room enthusiasm and positive spirit, we've got to combat this sense of despair. And that is why aspiration has to be converted into actions, and actions have to be achieved. I want to add one more point to this, is that, you know, in this panel itself, you have a mix of government representatives and non-governmental representatives. And it's very important that this is a partnership. In the hall here, I mean, at least from my country, I can recognize Center for Science and Environment, IIT Delhi, Dr. Kumar from Safdarjung Hospital, my organization, CEW. We've all been at this for decades, and there are many more, so pardon me for missing out on some of you. So this is, again, not just the responsibility of governments. As I said in the earlier session, we have to collectively create a democratic demand for clean air. And that is a partnership of science, of civil society, of contributing to the science, and governments and citizens converting that into action. What is needed, therefore, which goes back to 35 by 35 or a broader airshed approach, is the institutional frameworks that make sure that this happens consistently. Not just at a WHO conference, not just at a regional meeting in Kathmandu or in Thimphu or in Colombo, not just during the high pollution season. This is an year-round problem. This is a geography-wide problem. And once we internalize it this way, we can start leveraging the mechanisms we have. My last point is follow the principle of subsidiarity. What is often missing in our actions is that we are playing a passing the parcel game. So yes, airshed approach is needed, but the lack of airshed approach should not be any excuse for not doing what you can do within your geography. What you do within your geography should not have been no excuse for what you do within a sector. So when we follow the principle of subsidiarity on transportation, on clean cooking, on clean construction practices, then bring that up at a state level actions come up to the national level action becomes international cooperation, then we can again leverage the institutional mechanisms that we already have, strengthen them, and maybe create new ones that can promote better coordination.
Thank you, Dr. Ghosh. And bring it the same question probably, since we're from many sectors here. For the government, what is lacking is if everything is there and on the table, like Ms. Saida said, and as Mr. Ghosh tries to the awareness, what is lacking due to, for example, in Punjab province, you've adopted to involve community, business, civil society, and in order to improve this and put them on the table and work together, what would you say from the government side, from the public sector, what is lacking?
Government has huge responsibility. I must agree with Dr. Ghosh and with you as well. In this hall, we three civil servants are, taking part in this conference. And this is happening for the first time, even this is my 27th year in service. I've never been so passionate about any department. I've never been so passionate about environment. And I have never come across such a government in my province which has made it a priority for it in its agenda. And me and my Director General sitting here, we both have committed that we are not going to leave this department unless we clear the air or clean the air of Lahore. So I think more actions are required. Policies are there, rules are here, acts are here, but now we need action. As I already mentioned, brick kilns has been a biggest challenge for province of Punjab. 11,000 brick kilns, all emitting smoke. And despite our warning notices, helping them converting to zigzag technology, Dr. Pima know it, but somehow the polluter, the chronic polluter, we had to demolish 1,500 break-ins. So there has to be stick and carrot policy, of course, which is lacking. But trust me, in Punjab province, we actually have got full support of the political leadership, full support of international development partners, even our courts, the law, they back us whenever somebody go there and seek relief from them. They deny that because now it has come to notice of everyone. Let's say everyone has to work towards a better environment now. So I think the only thing which is lacking is action. So we all governments, of the region, they must start doing action. Of course, we have policy papers, we have advisories, we have documents. The libraries are full of all such things. The only thing is action. And coming back to as you just said, that now we are connecting with the people. We have established 1373 helpline, and on daily basis we receive thousands of calls because we work 24/7 call center, and we resolve those complaints. We give feedback to the public, and it has actually increased the faith in the state. Now people know that our government is working towards betterment of the environment. Similarly, this time we have hired 2,000 interns, and over 100,000 applicants received, and only 2,000 could be selected because of paid internship. Now our young environment graduates, they are working with the communities, and they are raising awareness amongst them. The community cleanups are there. They are planting trees. They are educating the poor communities to how to look after the environment. Then we have, with the help of World Bank Environment Endowment Fund, $50 million, and that is for those who for R&D, for switching to the green technologies. Then we have $2 billion fund which is given to as a soft loan to the small and medium enterprises for switching over to the green technologies and environment friendly. So there's a lot of happening in certain parts of South Asia, and inshallah, God willing, this year we are ready to take head on with the smog season, because smog season starts around September to January, so 4 or 5 months. And we are prepared. We have raised a 250. We have raised a environment protection force, which have got like 250 electric bikes. They are fully equipped, fully trained. They all are actually environment graduates. So government is committed towards that, and you will be hearing good news from Punjab province, inshallah. And again, I know the World Bank being there, we are going to sign a new project, Punjab Clean Air Project. Again, we are going to work together towards the better and cleaner air for Punjab.
So everything here is recorded, so I hope to see you, I don't know, even 2030, yeah, I mean, we should sign it, or we can meet again at 2035 and say that we exceeded the goal, Mr. Pema. What grabs my attention here is, can you elaborate a little bit more on what you see as a key international experience that can ensure effective air quality management between these countries with often different political systems?
Okay. That is, I think, a question to probably a politician.
I don't want to get them in trouble, so you can...
No, that's okay. I think we all acknowledge that pollution, air pollution affects all of us. Yesterday I heard Dr. Ghosh saying is the biggest leveler. Yes, in terms of its distribution, I think it is very democratic. It affects everybody equally. But in terms of the response, then it is very discriminatory, because then the poor are the most affected. And then we need to see how we can address. Now, I said that we have reasons to be optimistic, because if I go around South Asia looking at the good practices now, the initiatives that are being taken, you look at Delhi. Those days when you drive around Delhi, you have these three-wheelers, the tuk-tuks as you call it, very, very polluting, things. You used to see dark tubs of, smoke. And now we don't see that anymore. And electric vehicles, so much emphasis is being placed there in terms of replacing, all the buses were now replaced by electric buses. So there's so much progress on the ground actually taking place. And you see that across South Asia. I saw that in Bangladesh, I saw in Nepal now hundreds of electric vehicles coming into Nepal. And so many people also now also taking to riding bicycles to work, walking to work. So this is happening, it's a movement. But it will take time, but I think when I said war footing, in the hotspots, we really need to, again, go on a war footing because we have the solution. It's not as complicated as we think. So the political will, I think, is improving, is coming together. So we have to look at one region, one atmosphere, because we have only one atmosphere. Yeah? We have many countries, maybe many territories, but only one atmosphere. And I think that is the reason why I feel that we have to be really optimistic. Now, going forward, we'll work with the World Bank to take forward the Kathmandu roadmap that we signed. I think you all signed, not me. But so the leadership, the ownership is with the regional member countries and with the territories concerned. They will drive the process. They will drive the implementation and so on, the investment. But ISIMO will support other organizations like the World Bank to facilitate the discussions, the dialogue. So we already have had 2 rounds of science policy dialogue. Now the Kathmandu roadmap was followed by a meeting, the science policy dialogue in Thimphu in Bhutan, where we came up with the Thimphu outcomes, where we set out several action points that we need to take. And now, recently, we already put that one of the recommendations in place by having the first technical committee meeting as a committee of experts from around the region.
Yes.
So the experts have already now recommended the formation of 3 working groups, which are already in process. So we have one working group on monitoring, we have one working group on solutions, and one on investment. So bringing all together. Now we are learning from the European Union's experience, see how we can apply that. We are learning from China's experience, how they managed to control the air pollution or improve the air pollution. And we are looking across, not only in the region, but across the globe to see good examples of modeling, of monitoring in ways that could be applied in our region. So to conclude, I'm very optimistic.
Thank you, Dr. Pema. Dr. Ghosh, I think you have very little because I want to open.
I know we are also waiting for
and we have
Dr.
some
Nehru
closing
to
remarks, so
yes,
please.
Exactly. I think you said something earlier and then you asked this to Dr. Pema as well. I think the one thing that's common is we will need the stories of success also to be amplified, right? And I think we missed that. 15 years ago when our solar mission began in India with less than 20 megawatts of solar, we are at 220,000 megawatts of non-fossil electricity capacity. Last year, India sold 1.67 million EVs. Not a single one of them was a Tesla. 95% were two-wheelers, three-wheelers, and buses. All the public subsidy is now for procurement of public transport, not for subsidizing private. Within about 3 years, the penetration of clean cooking went up from 50% of households to over 80% of households. And we can see that there is 55% lower respiratory illnesses in those households that have adopted. So I think bit by bit, when we line this up, and whether that's happening in Pakistan, whether it's happening in Nepal or Bhutan and Bangladesh, in India, we've got to add up these success stories to then demonstrate what a collective coordinated approach could deliver, right? So this goes back to aspiration converted into action, which is achieved. And that's really the formula here. And it's totally doable.
Thank you, Dr. Ghosh. I think we have time for 2 questions, probably very short questions if someone wants to take the advantage of this panelist here. If not, I can continue asking more questions. Yes, sure. Do you have a microphone or I can give you one of them? Thank you, Dr. Pema. I'll get back.
Hello, Salkum Abid Omar from Pakistan. So the panel started with a laundry list of actions that are being taken place in the respective countries. and it seems like air pollution shouldn't really be a problem. Whereas just last November in Lahore, we saw 1.93 million people going to the hospital as reported by the health department, and PM 2.5 levels staying above 500, even reaching 1500 micrograms per cubic meter. So my question is that are these actions enough to have a measurable difference?
Of course not.
Secretary.
Last year, Lahore witnessed unprecedented surge in smoke, and that was the most difficult year in the history of Punjab. As I just said, that we have just started, it's just a beginning of a long journey. Lahore has suffered a lot for the whole decade. I mean, for the last 10 years, there's been smoke, but we did not take it very seriously. But this time, we mean business. That's why I've just mentioned few actions, kinetic actions we have just taken. Now, there would be more sakti, as you can understand. We will be coming very hard and tough on violators. We are not going to let other pollute the city and the whole city suffers. So I completely agree with you. This is not sufficient. We have just started, and we need your help. We need everyone who's concerned. We need them. We want to take them on board. And this time it's going to be, inshallah, a different Lahore during the smoke season.
Thank you. I wish we could have more space for more questions, but I want to invite here Anna Sauter. She's International Air Quality Advisor for UK Foreign Commonwealth and Development Office. She's going to do some closing remarks. Thank you, Anna. And as well, we have also Dr. Maria Neira later. Thank you. You just...
Is this working?
Yes.
Yeah, perfect. And thank you very much to the panel for your really interesting remarks. Too small for the for the microphone. So yeah, I'm here with the UK government. I'm Anna Saunter, and I'm an international air quality advisor. And we're a development partner with the World Bank. And the UK's air quality management work in South Asia has focused on the Indo-Gangetic Plain and Himalayan Foothills region, where air pollution levels, as I'm sure we've heard today and over the course of the last week, the air pollution levels there can reach up to 50 times the WHO recommended safe limit, and is responsible for over 2 million premature deaths in the region. As we well know, and everyone has said it time and time again, that air pollution doesn't respect borders. And I think, as you can see on some of the flyers around the room, that nearly 50% of the air pollution in major cities in South Asia is transboundary. So I think we've talked about it, but actions just at the local level, just at the national level, isn't enough to kind of solve this big problem. So the UK government has funded a Climate Action for Resilient Asia, or CARA program, which is hoping to kind of tackle these issues. So by partnering with the World Bank and the International Centre for Integrated Mountain Development, the UK is investing up to £274 million over the next 9 years on climate adaptation across the Indo-Pacific region, with an important component on air pollution. This program has involved developing a regional air quality management program in 4 countries in the region: Bangladesh, Bhutan, India, and Nepal. It has enabled the World Bank and ICIMOD to design investment programs and carry out crucial data gathering and analytics, which has brought into sharp focus the year-round transboundary nature of the air pollution problem in this region. As a result, there has been a shift from treating air pollution as an urban-centric issue that plagues specific cities and specific countries to a broader airshed approach, as we've heard, spanning states and countries, with governments actively seeking cooperation. Now, the World Bank is actively engaged with 12 different national and subnational jurisdictions, including 8 state governments in India, to implement a regional air quality management project. The CARA program's work shows that while there are huge challenges to building and maintaining cross-border interagency coalitions, significant progress has been made towards aligning efforts in different countries. So I think, as it's been made abundantly clear in the panel today, sort of this continued cooperation that's done in a sustainable way across sectors, across all different layers of government, is completely vital to achieving both a more effective and more cost-effective solution. Thank you.
Thank you. Thank you so much. And I want to call Dr. Maria Neira, Director, Department of Environment, Climate Change and Health from WHO for her closing reflections. Welcome.
Thank you. Thank you so much, and a pleasure to see you all, and a pleasure to hear what you were saying. As you can imagine, from WHO perspective, the one putting together this conference with many other partners and people is such a satisfaction. When you attend a meeting organized by the World Bank, there are words that you are expecting, which is financial aspects, bankers, and things like that. Today, the words I heard are the ones that are giving me a lot of hope. I heard about passion, somebody from a government saying, I'm extremely passionate about that. I took note as well about what you say, that you will not leave until you clean the air of Lahore. And I want to be there with you, and I hope you are not expecting too much because I cannot afford it. I mean, I have a certain age. But please do it quickly because I will love to celebrate with you. And Dr. Ghosh talking as well about the need of creating a better narrative, looking and building on our successes and making sure that we convince more people. The first conference was 7 years ago, and I see the difference. I know that 7 years can be considered a lot of time, but I see the difference. Definitely, we see very serious commitment. We see very serious advancements. We see no excuses on what we have to do. And of course, I share your optimism. I agree with you that the target we are putting on the table is not enough. Maybe we should change it for tomorrow and put it something a little bit more ambitious. When WHO released the air quality guidelines a few years ago, many of the journalists were asking us, don't you think this is too ambitious? And I said, well, it depends how many lives you want to save, because in my opinion, for public health, ambitious is never big enough. But now, if you can afford that you are on your shoulders the deaths of many people, that's your decision. But be aware that this is the case. You know, I've been trained as a medical doctor, and we have a very structured mind. We do a diagnosis, the best we can, with the technology we have. Then we propose a protocol for treatment, and then we prescribe. And here I realized that the diagnosis is very good, very solid, everywhere. We have a good protocol for care, for treatment, and we are trying to do prescriptions, but I'm afraid the patient is not taking those prescriptions, is not following. So by this collaboration, by this new narrative, by these targets, by the fact that the governments recognize that this is the topic related as well to security, I think you realize very well on this particular environment here with a very eminent economist, you realize that air pollution is polluting our economy as well. And it's polluting our health, but it's polluting our economy. So definitely happy to join forces. Thank you very much for giving me the hope of the day. I hope maybe this afternoon will be more, but at least I can tell everyone, all of my colleagues that I heard on a World Bank meeting, people talking about passion. And that's something that moves all of us, human passion. And the health of the people is the best of the human passion we can have. Thank you so much.
Thank you. Thank you, Dr. Neira. Thank you to Ms. Saida Rizwana, Dr. Ghosh. It was a pleasure. Secretary Raja and Dr. Pima Gyamso. It was such a pleasure. Thank you for this panel. Applause for them, please. Gusto. ¿Cómo estás? Go ahead.